Healthcare setting and the healthcare team. Ambulatory care setting. Individual and group medical practices. The individual practice, also called your solo practitioner. One primary care physician sees and treats patients. One provider is responsible for all the costs. Individual and group medical practices. A group practice has 2 or more providers that share the costs. The providers can consult each other. The patients may request the same provider for all appointments. It ensures there is always a provider on call. About 68% of providers practice in a group such as this. You have urgent care centers, usually private, and they are for-profit centers. They provide primary care, treat routine injuries and illnesses, and perform minor surgeries. Sometimes an urgent care facility can be used instead of going to a ER for a minor emergency. Providers are often salaried employees. They see higher volume of patients, usually for a lower cost than a hospital emergency room. Managed care organizations, health maintenance organizations, HMOs, provide a full range of services under one roof. We have PPOs, Preferred Provider Organization, is a physician's network. And you have independent physician associations, IPAs, treats patients for an agreed upon fee. Boutique and concierge medical practice. Sought by patients, discouraged with insurance reimbursement. Provides immediate access to provider for 24/7. Convenient, unhurried appointments. They have unlimited access to emails, fax, phone, and consultations. They can do home or work visits as needed. Coordination of any specialist referrals. And there's a set fee for services required for an exclusive service. These are usually fairly expensive services. You'll see this more in your large cities and your more upscale, richer communities. The healthcare team includes your primary care physician, specialists, and all the allied health professionals. The title doctor. A physician has a degree of Doctor of Medicine, MD. There are other medical degrees. There's doctors of osteopathy, a DO. There's doctors of dentistry, DDS. Doctors of optometry, OD. There are non-medical disciplines. Doctor of Education, Doctor of Philosophy, and Doctor of Psychology. A Doctor of Medicine requires 4 years of medical school after a bachelorette degree, and then an additional 3 to 7 years of residency. You must have a state license and earn CEUs every year. A Doctor of Osteopathy is 4 years of medical school after a bachelorette degree, and can work in any specialty area after 2 to 6 additional years of training. You must have a state license and earn CEUs every year as well. Alternative medicine care practitioners. Many carry a title doctor and have specialized training. The CDC estimates that 36% of patients use alternative medicine. Some alternative healthcare practitioners, your doctor of chiropractic, pays special attention to the physiological and biochemical aspect of body structure. They adjust and manipulate the spinal column, and they are licensed in all 50 states. A doctor of naturopathy, ND, they attempt to remove the underlying cause of a disease and stimulate the natural healing process. Licensed in some states, they may practice independently, unlicensed, or practice under the direction of a medical doctor. Oriental medicine, acupuncture, Chinese herbology, body work, dietary therapy, and exercise. The attempt is to restore the energy flow. Nearly all states regulate the practice of acupuncture and Oriental medicine. The role of the medical assistant. They perform both administrative and clinical functions. They can be receptionists, secretary, office manager, bookkeeper, patient educator, insurance coder, and biller. We draw blood, we do vital signs, we do EKG, we do wound care, and we do histories and physical. We have to maintain positive attitudes. We function under the supervision of the professional and as the communicator and liaison between the physician, the patient, and the hospital staff. Other allied health professionals include health unit coordinators, medical lab technologists, registered dietitians, pharmacists, pharmacy technicians, phlebotomists, physical therapists, physical therapy assistants, and nurses. There is also physician's assistants. They can perform diagnostic, preventative, and therapeutic healthcare services diligently by the supervision of a physician or a surgeon. They may prescribe some medications. They can supervise technicians and medical assistants. They must complete formal education and pass the Physician Assistant's National Certification Examination. With a broad range of competencies in both administrative and clinical areas, the medical assistant are increasingly valued as part of the healthcare team. We need to be great communicators. We serve as liaisons. We are valued as a competent, professional, compassionate medical assistant is immeasurable in today's fast-paced and challenging healthcare environment.